Alright, hi guys. So, welcome to Module 5. In this module, you are going to take the articles that you've looked at and the caps that you created, and now you are going to complete the rest of the caps. So, here is a worksheet that we're going to use, which I'm going to come back to. Let me re-pull up the cap 1 second. Going back to Module 4, and I am pulling up your cap worksheet. Alright, so this is the worksheet that we've been working on since Module 4. Just a reminder, in total you are completing 5. 1 based on the article that I gave you, and the other 4 are the articles that are associated with your PICO question that you asked. So just as a reminder, here's a sheet. Up to this point, we've pretty much have answered all of it up to results section. Now we are going to go down and we are going to complete the rest of the CAP worksheet for all of your articles. So we're starting at this section right here, results. First and foremost, you're going to list your key finding based on study objectives. Include statistical significance when appropriate, and include effect size if reported. Then you're going to answer various questions like, was the study adequately powered, large enough to show a difference? Okay. Were appropriate analytic methods used? Yes or no, or NR. And were statistics appropriately reported in written or table format? And then, what are the percent or number of subject participants who dropped out of the study reported? So again, that's the lost to follow-up number, or it may state it as that percentage or number of subjects or participants who dropped out. But that is your loss, essentially your loss to, it could be your loss to follow-up number, or just, it could literally say this. You're going to discuss, were there any limitations in this study? And then you're going to put a conclusion. So this part is fairly simple. It's very small, but this is going to be your biggest section because you're going to really expand on this and give in detail the full statistical analysis that was talked about within the article. Now, with that being said, this section should be fairly lengthy depending on your article and what they did. So that sums that up. Now, the second sheet, or I guess the sheet that you should use in conjunction to completing your CAP that would help make more sense of the information within a results section, is this Module 5 Critical Appraisals of Results assignment. Now, I actually do want you to complete this and turn it in. Now, if you've noticed, in Module 5, which I will go back to the folder, I did give you a few worksheets. One of them is, I'm sorry, I'm still in Module 4. One of them are just to assist you with completing the assignment, and then of course the one that I just showed you is the one that you're actually going to use. So this here, RCT appraisal, sorry, my computer is moving fairly slowly. This sheet is to actually just help you understand the results section. So I would encourage you to use this and complete it as you go, but it's not a requirement that you have to turn it. Now, essentially what this sheet is, it helps you first and foremost put your PICO question, and then it helps you answer questions based on the information below. Like where to find it, what is it saying, and then you can kind of use this to tailor your information to put into your CAP. That will go in here. And then the rest are just questions. So that's that. Now, let's go back to this CAP, or I'm sorry, this critical appraisal results assignment that I want you to turn in alongside with your CAP. Now, why am I having you do this? Because I want, again, to stress the importance of statistical analysis within research, and to make sure that you kind of have an idea how to connect the topics that we've talked about. Now, this worksheet is a little different. At the very top, we're going to talk about measures, and within your readings, you'll discuss measures. You'll learn about measures, but as you know, measures are the things that they're using to determine an outcome or assessing during the research. So you may have a few, you may have one, but I'm pretty most of the time you will have more than one. You'll have your, depending on your primary objective and secondary if there is one. You're going to list out all of your outcome measures that are being looked at within each article. So you're going to complete one of these for each article, and then you're gonna put the level of data. Is it nominal? Is it ordinal? Is it interval? Now, in case you're wondering, you don't remember all of this, you can go back and look at the past slides that I've given you, or you can go ahead and go back and read your Linda Fetters and Julia Tilson, which is actually what you're going to be reading for this module. So chapter 4, page 50 and 51 talks a little bit more about the various levels of data and what you're looking at. Then you're going to talk about the type of data. Is it continuous? Is it dichotomous? And then, is the outcome measure valid or reliable? Because what we're looking at should be valuable and reliable. And is there evidence for reliability and validity? Generally, articles, when they're talking about the different measures that are being looked at, they should tell you how they determine whether the measure that they're using is valid and reliable. Excuse me. Now, you're going to go down and we're going to go a little further. So now we're going to dive into the actual results. You're going to, again, list those outcome measures, but they're split. So they're split between continuous outcomes and dichotomous outcomes. So if you have or are looking at continuous outcomes in your research article, they go in this section. And you're simply going to put what it is, the type of statistical test that was used, the p-value that was provided, effect size, if it is provided. Article should provide you with enough information to either figure it out, which I've talked about in a previous lecture that you can find in this module as well, or it should give you the actual effect size and as well as the confidence interval. So you're going to list those here. Now, if it's dichotomous, we have to do a little more work, okay? We have these things that I'm going to talk about with you, so don't fret, and it's also your readings. But essentially, as you would do for your continuous data, you're going to do it for your outcomes, or I'm sorry, your dichotomous outcomes. Now, again, all articles, and depending on the type of research that you're looking at, may not provide you with this because you may not have dichotomous outcomes. And for the most part, you should see a confidence interval or number needed to treat. Or I'm sorry, number needed to treat the confidence interval for that. But again, every article is not the same. But nonetheless, there are equations, and you should be provided with enough information to figure that out. Last but not least, you're going to complete this. Are there clinically meaningful differences between the subjects of the study and your patient? I want you to answer these questions. They don't have to be very long, but I want to make sure you grasp an understanding of what we're looking at in results and understand the importance of this section. Alright, now that we've kind of taken a look at this sheet, let's go into detail about this section here and what you're looking at so that you become a little more comfortable. It won't be easy. These numbers and these equations will seem a little new to you. You may have trouble interpreting this information or trying to calculate it, and you may not have everything you need. But with that being said, it just takes practice, and we'll go through your articles, and you will go through your articles and make sense of that. So let me pull up my actual PowerPoint here. Okay, so we're going to talk about interpreting and analyzing results. We're going to look at CER, EER, RR, OR, AR, NNT, ARR, and RRR. I know, there are a lot of these, but don't worry, I'm going to go through each. Okay, so in simplest form, most clinical questions are related to one or two issues, and that is whether a particular outcome differs between groups who receive different interventions, or whether the outcome is associated with some other factor. We need to make sense of that. And that's kind of how we get into looking at all of these various statistics to dig a little deeper and making a valid assumption about what we're studying. So when we are looking at dichotomous data, we are interested in making an association between two variables that are measured on a nominal scale consisting of only two levels. So here's an example of that. We may be interested in whether a risk factor is associated with the presence or absence of low back pain, or whether the use of a new mobility aid is associated with an increased likelihood that a patient will be discharged to home as opposed to discharged to a supervised care facility. For those types of questions, often chi-square is commonly used, and the probability associated with that reflects the likelihood that an association between the two dichotomous variables is due to chance. You want to have an understanding of the effect size, and that helps to make sense of a clinical relevance of a relationship between variables. So essentially, you can't say something is better without knowing how much better, and you can't say something is or isn't related without saying to what degree. Now, what does that mean? So, when you hear often a physician may say there's a 75% chance that this will work or won't work, or there is a 10% chance that these things could happen during a procedure. Well, that was based on looking at these various number needed to treat odds ratios and such to come up with those statistics that you often find within clinical practice. Now, estimating magnitude of association between dichotomous variables. The OR, which is odd ratio, and RR, which is relative risk, assesses the power of association between a negative exposure, which is a risk factor, and a disease. In OT and PT, it is applied the same way you explore relations such as risk factor of poor balance to a disease such as a fall or hip fracture. We assume the outcome is negative or an unwanted event that the exposure may, quote unquote, increase the likelihood of a negative event. So here's an example. You wish to estimate the association or an ergonomically sound workspace, a subject that have a positive exposure or do not, and what you hope to find is a decreased likelihood of negative outcome like carpal tunnel syndrome. Now, first and foremost, you need to understand what is the disease, what is the outcome, and is it positive or negative? Well, the disease that we're referring to is carpal tunnel syndrome, and the outcome would be negative. But it is anticipated that the exposure to an ergonomically sound workspace will decrease the likelihood of the disease or carpal tunnel. Let's look at another example. You wish to estimate the association between a new intervention for athletes with an anterior cruciate reconstruction, treated or untreated, and the likelihood that the athlete will return to the sport or not. What is the positive outcome? To return to a sport or other measures of success, and the exposure is a new intervention component that they're going to use to determine this positive outcome. Alright. Now, so RR, which is also known as relative risk. So when you see this, that's what that is. Relative risk measures association between the presence or absence of disease and the presence or absence of exposure to potential risk factor. My apologies. Generally, in a cohort study where the exposure for all members of the cohort is ascertained and the cohort is followed forward to determine later the disease status. So basically, a group who has it and a group who does not. Now, we haven't focused a lot on cohort studies, but you may be looking at a study that is, and that's why we need to know these things. We need to understand relative risk. Now, how do you calculate relative risk? It's calculated by counting the number of individuals in the cohort with and without exposure and counting the number of individuals who do not develop the disease. You will see this in a 2x2 contingency table. This is why I mentioned that chi-squares are often used. And here is the equation. Now, I won't dive into this because I'm going to show you an example. If the exposure does not affect disease occurrence, the incidence of disease will be similar for both exposed and unexposed individuals. If RR equals 1, then there is no association between exposure and disease. If the exposure does increase, the RR will be greater than 1 because the numerator will be larger than the denominator. If the exposure provides some protection from disease, the RR will be less than 1 because the denominator will be less than the numerator. Sorry. It's my nose. So here's an example that I used and provided you for as a 2x2 contingency tables, and to use this to explain to you when we're looking at these numbers. So in this example, we have a total of 100 subjects that were randomized to a structured program in which they are warmed up before practice. This is the exposure. And 100 did not warm up. Of those in the exposed group, 14 experienced a knee injury. That's cell A. 86 did not experience a knee injury. That's cell B. And in the unexposed group, 27 experienced a knee injury. Cell C. And 73 did not experience a knee injury, which is cell D. Now, to calculate the relative risk, you need to determine the proportion of knee injuries in the exposed group and I'm trying to decide if I want to go through the numbers, but I've listed everything here, and you will get a copy of this. So you can look at this to determine how to use it and calculate it because you have the numbers to do so. I just want to give you an example. This is what you're looking at. You have A, B, C, D. Essentially, relative risk. And here's the equation again. A divided by A plus B divided by C plus D to get your answer, okay? And only because I don't want to take too much time in the lecture going over these numbers, because it might be easier for you, especially since you have the information down here, which I definitely encourage you to utilize to try these numbers out. Now, CER and EER. So on that worksheet, you have CER, EER. CER is control rate event, and EER is experimental event rate. And here are the equations. Now, why do we care? Because you have to use CER and EER to determine absolute risk reduction. So CER, EER is used to determine absolute risk reduction. Okay? It's looking at risk difference, and again, here I'm giving you the equation to do so. Now here's another example. Uh, and again, all of the information is down here, but look at the numbers and see if you can come up with the same numbers to answer for absolute risk reduction. Now let's look at odds ratio. Now we've talked a little bit about odds ratios, but odds ratio is odds of exposures in case, those with disease, and the odds of exposures in control, those without. The odds for each group, case, or control is the proportion of individuals in the group who have been exposed divided by proportion of those in the group that have not been exposed. So again, another 2 by 2 contingency table, and here's what it would look like. Now this is the odds ratio again, but I'm just giving you another example of what that looks like. Okay? Now, odds ratio will be 1.0 if the odds of exposures are similar among the subjects with and without disease. Odds ratio will be greater than 1.0 if it indicates an increased likelihood of exposure among disease subjects, positive association between exposure and disease. If it's less than 1.0, indicates decreased likelihood of exposure among diseased individuals, a negative association. And if you are calculating it from a 2 by 2 contingency, uh, when estimating the risk of exposure given disease, or estimating the risk of disease given exposure, it will be the same. And it's used in case control studies because RR, relative risk, cannot be computed. So subjects are entered into a study based on disease status and or estimates odds ratio estimates the likelihood of exposure given disease. Now again, we haven't really focused on case control studies, but again, you need to have an understanding of what some of this is. Now here's an example. Subjects are chosen on the basis of whether they have CTS or not, and then their ergonomic environment is ascertained. How would that equation look? Well, and again, it's down here. Odds of exposures to ergonomically sound workspace given CTS divided by odds of exposure to ergonomically sound workspace given no CTS. Here's the answer. Now, using another example, subjects are chosen on the basis of whether they received intervention or not, and then return to sports. Status is ascertained. So again, I'm using the same examples from the previous slides within this deck. I'm just putting it in a way that you would understand how that equation would look. So in this case, it would be odds of exposure return to sport among those receiving the new intervention divided by odds of return to sport among those not receiving new intervention. Now, relative risk or relative risk reduction. That's this. We know what relative risk is. Individuals who are exposed and not exposed to a risk factor that are identified at baseline. And relative risk reduction is based on CER, which is again the control event rate, minus experimental event rate divided by control event rate. Here's another look for relative risk. Now, last but not least, well, in a sense of what I'm going to describe is the number needed to treat. And confidence for a number needed to treat is literally just a confidence interval that's provided for this. So you may or may not have that information in your article. And if you don't have something, just simply put NA. So, the number needed to treat. The number needed to treat is the number of patients you need to treat to prevent one additional bad outcome, like death or stroke. So, for example, if a drug has a number needed to treat of 5, it means you have to treat 5 people with the drug to prevent one additional bad outcome. And how do you calculate that? Well, again, using your ARR, you can do 1 divided by your ARR. And remember, ARR is CER minus EER. And number needed to treat are always rounded up to the nearest whole number because we are looking at patient population. Okay? So this kind of outlines the critical appraisal of results worksheet. Now again, this won't be simple, but take your time doing it and just try and do your best in the sense of making sense of what's provided in your article. I'm doing this so you have a better understanding of what it looks like if you map it out and where that goes. Now again, you may or may not have this and you may or may not have that depending on the type of research that you've looked at. And if you don't have it, again, that's fine. Just write NA. Okay? But nonetheless, it helps to break down the type of measures that we're looking at, the level of data. Is it reliable or is it valid? And what are you taking from that type of outcome measure that we're looking at? I hope this lecture helps. Again, always come to me if you have any questions, and again, we will discuss this in class.